All. This is Dr. Mobeen Sayed from drbeen.com. This is our random chit chat. So thank you very much for being here. So this is StreamYard. Kamran, hello, how are you? Algebra Bean, hello from Chicago. Algebra Bean, how are you? Hey, Cool Beans, hey, back to you. D Diaz, hey. Susan, I'm on the early list, yes. Anna Strange, hello, Cool Beans. Doug, hello. Rajesh, yes, in top 5, good one. Skyfrog, almost first. Denise, yo, back to you. Patsy, Looney Bean here. The Shri, Janna, how are you doing? Connie, hello. Abdullah Musa, here with the question. So all hellos stopped now and the answers, if I can. Abdullah Musa, I have had AstraZeneca vaccine 14 weeks ago, about 4 months and something. And today I had Pfizer vaccine. So 4 months, I refused to get AstraZeneca. Will I be okay? And plus I will need a second Pfizer, as a clinician says, clinic is saying that they will be considered as a first dose. Interesting. So number one, again, please don't put me in a state to give personal advice. From a theoretical point of view, 4.5 months ago, you're getting somebody getting a second dose of a different vaccine. So far, they saw that the second dose, different vaccines, side effects were more. So if you got it and you are not seeing much side effects, and good. And the second dose, meaning the third dose is fine. It actually, your immune system is not going to even bother about it. And if you would like me to explain the mechanism, I will. Arun, how are you? Rubies are red. How are you? From Canada. Roller girl, how are you? So Rubies, do you know that my brother, so we are 4 brothers. The oldest is Dr. Najib. I am third. Second is Yamin, who lives in Canada. He's a Canadian citizen. And then youngest is Hasnan. So 4, Najib, Yamin, Mubin, and Hasnan. So Yamin lives in Canada, and he has been asking me, I sometimes go to Canada to meet him. He's been asking me that, hey, when the pandemic is over, come see me. So I'll probably go to Canada. I love Canada. Joy, hello. Abdullah Musa, same question. Rice Bunny Local, hi from Orlando. Brian Wong, hi dog, hello, back to you. Kitty Girl, hello, hi, back to you as well. Abdullah, same message. Catherine, no, not first from Arizona. Good one. Hello, back to you, to Arizona. Hello, sir. Critic. Abdullah, same message. I saw. So Pase says, if doctor does not answer, if you get infected, then your body respond by beating the virus. Vax infects you with virus to teach you how to respond. No teaching needed if you already recognized it. You are correct, Pase. Margaret, hello, how are you? Kathy, hello, how are you? And this also kind of rubs so negatively to those who are squarely in the vaccination corner or anti-vaccination corner. They say, why do you say vaccination is not needed if a person has become infected? And I always give a mantra, which I think folks now know what I say. But if somebody has already recognized it and healthily recovered from it, then and Jinsar Rest says, Dr. Bean, would you recommend vaccinated people to also take ivermectin as prophylaxis or high-risk situation and for treatment of symptoms of COVID to appear? So I'll tell you about myself. I am so chicken that every time I feel I've done something that would still expose me, I rush to ivermectin and I take it. A few days ago, I mentioned it, that I accidentally just took the coffee cup and started drinking it right there, meaning coming out of Starbucks and removing the mask. I just didn't clean it. And then I took ivermectin. A few days ago, after that, I was exposed to someone who was in vicinity and they were not wearing a mask. So I'm okay outside, not wearing a mask is fine, but they actually stopped to talk with me. So then I came back and I took ivermectin. So ideally, the right thing for me to do is to continue to take ivermectin on a weekly basis. I have become a little less compliant to that, but I do take ivermectin as soon as I feel that I am at risk. Gold Country says, Dr. Bean, time to go back to the basics of a strong immune system. The importance of vitamin D should also be much more emphasized. Absolutely, Gold. Absolutely. Vitamin D is the first thing. We saw this in the beginning as well. Those folks who are at high risk, that means age-wise, comorbidities-wise, and whose vitamin D level was greater than 39, they had death rate of fraction of a percent of 100, and maybe I think it was lesser than 1%. And those in the same cohort, those whose vitamin D's level were below 39, not 29, 39, their death rate was 6 or 7. So I did that discussion as well. So very important. So you are very correct. John Snyder says Canada is nice. Yes, I love Canada. Jana says, that's cool. Go have fun in Canada. Yes. My brother almost on weekly basis now says, when are you coming? Colin Hamill says, since it enters via the nose and mouth and nicotine kills it, would smoking be less harmful than the alternative of getting the virus? Rhetorical. We now know smokers globally are affected less. Good one, but there is a adjustment to this, Hemi. Adjustment is this, and I talked about it. Nicotine helps reduce viral binding to ACE2. That is a trick. But a smoker whose respiratory system is not in a healthy state is at a higher risk. So smokers as a comorbidity with the problem with their respiratory system are at a higher risk. But those smokers who got hospitalized and their smoking was stopped and their nicotine levels were not correct, they became more severely ill. So doctors said in France that give them nicotine patches so they have the correct nicotine level to continue to stall the virus. That is the actual data there. Irene says, hello, doctor, please advise, if one is taking ivermectin as prophylaxis, is there a need to have themselves vaccinated? Please explain the mechanism. So the need for vaccination with ivermectin is the following, and that means it comes to the choice. The need is this, that so far the data with ivermectin prophylaxis shows 74% or better efficacy. Now, when I say 74% or better, 74% is in the studies from Egypt, Malaysia, India. Better is when, let's say you talk with Dr. Syed Haider, who uses ivermectin. He says almost 100% of his patients who are on prophylaxis, or 99%, are safe. My own experience is my mother-in-law, for example, was on prophylaxis with ivermectin, weekly prophylaxis. I think she was not compliant, just like I'm not compliant nowadays. She got first dose of vaccine. I think she relaxed as well. Second dose, she says the day she went for the second dose, that day she became ill. I think she may have become infected a few days before. So she was taking, I would suspect, off and on. So that didn't help her and she became infected. But she has, her age is, I believe, above 60, and she has comorbidities as well. So I am very afraid of her. She's also in a place of variants. But when she got it, the only worst thing she got was anosmia. I was thinking that she was so much at risk that she might end up in a hospital. I totally panicked when I heard that she's gotten this. She actually thought that that was a side effect of the vaccine. But when she told me I have no anosmia and I have this and I have that, that was COVID. Gave her high dose ivermectin. And she was stuck in this for 4 or 5 days. And the day I started ivermectin high dose, second day, third day, anosmia was reversed and she was fine. And then I tried to give her steroids or other things, and she was, it is so funny that this is the second time I tried to give someone ivermectin and then steroid, and they refused to take steroid, saying, hey, I'm already cured. The other one was a long hauler. So to answer your question here, should we continue with the prophylaxis? If you feel that you want to have it, you can. Now, the question is, efficacy is not 100% in my opinion. So that means just like with vaccine, you are still exposed. I'm still exposed with vaccine. similarly with ivermectin, you're exposed as well. How much is not known. How severe is not known because that data is not collected yet. Second thing is, it is a matter of continuously taking ivermectin. So if you can do that, and if you can expect that risk and be okay with it, then ivermectin is a good thing, not bad thing. Now, in terms of mechanism, I have done a lots of discussion about how vaccine and the ivermectin kind of they don't interfere with each other. So vaccine would build your immune system's training, and ivermectin would continue to protect. Good news is that ivermectin can continue to protect for all variants. This part of my video can cause my channel to be struck, but the answer was important to do. No, so Janna, she didn't get the virus from vaccine. I think she had gotten infected before. So not from the vaccine. So she probably came in contact with someone 3-4 days ago. And then it just coincided with the day with the vaccine that she got the symptoms. France says the right thing. That is the best thing. Good pawing on last video. Now rinse and repeat. Yes, please paw on the videos. So I'll tell you the difference within. This happens every time I talk about these conspiracy theories and talk about them more clearly. Of course, my audience, I think some of the audience doesn't like it. So I have gone from 200,000 or more views within a certain period of time, I think 48 hours, to 110,000 more views. So it has become half once again. It happens every time when I talk about these things. So paw this, as France says, and that would help. Dr. Amir Hashmi says, sir, my sister had fever and sore throat. Given azithromycin, she's good, but she has loss of taste. Start ivermectin for this. Ivermectin high dose if she doesn't have any issues. High dose will be 0.3 milligram to 0.4 milligram per kilogram body weight. 1 full dose daily till she recovers. So why did I give an advice? I think I'm giving an advice to an area where I can give an advice. Overclock says, hi, doctor, I wanted to know, and Dr. Hashmi, please talk with me separately, maybe on Twitter or WhatsApp, so we can monitor her progress. Overclock says, hi, doctor, I wanted to know if the blood clots caused by adenovirus vaccines are really obvious as far as pain goes, or is it something that can be mild but sustained pain? They say that headache is severe enough that the person says, I need to be in a hospital. Similarly, the GIT upset is severe enough that the person becomes upset about it. The lead coldness or warmness or leg pain can be slightly less. Shortness of breath could be misidentified. So that means there are these things that bruising on the skin is more evident and obvious. So that means there is a possibility of missing it, but generally continuous, persistent pain, persistent headache, persistent GIT aches, joint aches, the bruising under the skin, leg pains, are shortness of breath are indicators to quickly talk with them. So even if you don't suspect it is this, talk with the doctor, at least have an idea. Doug says, have you gotten an antibody or T-cell test after vaccination? So no, not yet. And I should. Terry says, is it too late to hang monoclonal antibody therapy if someone is on ventilator? Monoclonal antibody therapy is for the virus itself, and somebody on a ventilator is most probably in a cytokine storm. So monoclonal antibody will not be that functional. Sorry about this. Dr. Amir Hashmi says, sir, why third wave can be more affected in children? So this is also part of the conspiracy theories, that because the virus is changing, this is not the answer. I'm telling you the conspiracy theory. Because the virus is changing and we have vaccinated the people, it is now changing to go and affect the children. Again, that is just a conspiracy theory. The basic problem is this, that when adults are becoming either infected and cured or vaccinated, then whatever is the population left, they would have a higher exposure. And that higher exposure would mean some people would get sick as well. So it seems like more children, but overall percentage is still the same. It's just that that population is now more exposed. Bo says, Dr. Bean, do you recommend someone who recovered 6 months ago from moderate COVID with pneumonia, no intubation, diabetic, asthmatic patient? Recommend what? Do you recommend someone who recovered 6 months ago from moderate COVID with pneumonia, no intubation, diabetic, asthmatic patient? Are you saying, do you recommend vaccine? If that is the case, if they have these comorbidities, I would suggest to take a vaccine. Yes. Christy says, lots of video freezing tonight for me. Sorry about that, Christy. Let me see. Sometimes what happens is, sometimes my network switches back to low 2.4 gigahertz channel instead of 5 gigahertz, and it just starts doing this as well. So I just looked at it. It is actually now on 2.4 gigahertz. So my apologies. It's my fault today. I usually check it and I switch it, but it just then attaches there too. So Zen Solo says, do vaccines contribute to autism? There have been opinions by doctors. So Zen, I think this is the biggest theory that started folks to become not vaccinated. In my opinion, there is a general part of population that does not want vaccines. They would look for any reason to be able to say why I don't want it. And I don't fault them. Here is why. If I don't want to do something, and somebody says, hey, are you going to do this? And I say, no. And they say, why not? And I say, because I don't want to. Then I have to defend more for myself. But if I say that, hey, you know what? This geared guy said that this is really bad. So he's a very reputable virologist. He's a great guy. I really trust them. And because they said don't do it, then I'm not doing it. So then now I don't have to defend myself. It's just geared. So I actually prefer, and I have been saying, if you watch my previous videos, I have been saying anybody who is here who does not like to have a vaccine, you don't have to convince me that you don't want to have a vaccine. This is sufficient for me to say, I don't want to have a vaccine. And I just respect that part. I'm not going to challenge you to go figure out why and bring me geared. Fine, you don't want to have a vaccine. That is your decision, your community's decision, your family's decision, your doctor's decision with you, your employer's decision with you. It's not my decision. And I would wish you good luck. And that is why I talk about vitamin D's and C's and ivermectins and hydroxychloroquines. So back here, autism was a thing that started. Since then, there have been many studies that say that autism can be caused by the vaccine or its adjuvants. There have been many studies that say it is not there. So this is such a big area of continuous debate that if I take any position in here, I am not enough knowledgeable to take that position. So I would actually bow out of this discussion to say, I don't know. There are so many, and I have tried to do my research. There are so many researchers who say it can happen. And there are so many who says it don't. So I think I won't take a position. If you ask me for my family to say, would you vaccinate your children? Yes, I did vaccinate them. I vaccinated them now as well for COVID too. So that is my personal position. I have never hidden my position. So Kathy says, is answering things in comments or somewhere else? Kathy, I do not know what you are talking about. Jerry says, what happens to spike protein bits after eaten up by macrophage? Does it end up in spleen body forever, or how ejected from the body? Very good question. So what happens is, most of the time, so this is a beautiful question to answer. Thank you, Jerry, for asking this. And thank you very much for the super chat. So here is what happens. Most of the time, when we eat up something, when we phagocytose something, it is made up of some, for our system, our body, it is made up of some amino acids. If it is made up of amino acids, sometimes they are made up of lipids or others. So it is made up of some amino acids. So what we do is we combine them with the digestive acids and we break these things down. We dissolve them. Once they are dissolved, now there are many outcomes of this. There are some pieces that have been destroyed and burnt, and then the remaining part would just secrete out and then go through the interstitium and be filtered out in feces or urine. There are some parts that would be taken out and presented on the cell surface to say, hey, look, guys, I have this weird thing with me. There's some parts that would just stay in here, and this cell itself would die as well. You know that a macrophage, once it is activated, it eats about 100 other things and then itself dies. And then that dead macrophage is eaten by other macrophages, and they digest that macrophage in the same way a macrophage digests other things. And they bring it down to all those tiny bits, and we can either recycle those bits. For example, we can take individual amino acids and use them to make other proteins, or we can flush them out of our body, or we can present them. So, good question. Joy says, would someone with eosophillic esophagitis be more susceptible, eosinophilic esophagitis, be more susceptible to COVID? So eosinophilic esophagitis would mean that the eosinophils are releasing more major basic protein, which is causing local inflammation. Now, it has nothing to do with the handling new infections. The problem only could be that eosinophils, when put with the cytokine on them, they might increase their activity. So there may be a flare-up, but that is going to happen with all kind of inflammations. For example, I had inflammation here when I got vaccinated, and that inflammation stuck there for 2-3 weeks. To the point that speaking here, for talking, I had to keep my mouth kind of this much open and talk like that, because if I would just open a little more, it would hurt, or if I would eat food, it would hurt. So I still remember those talks, that after the talk, I'm hurting, and then I'll go and have dinner and I'm hurting more. So the possibility is that the inflammation continues. But it is not necessary. So what I would say is that if somebody is going to get, let's say, infected by COVID, you just take your medicines, and COVID itself, will COVID be mild, moderate, severe? We don't know. There are so many people who are healthy, who have no allergies, no autoimmune problems, and they respond so disastrously to COVID or SARS-CoV-2. Versus there are so many, for example, I talked about my mother-in-law. I talked about my sons having allergies and getting vaccines. I thought they would get some reactions. They didn't. So there is no known way to say. So I saw some super chats, so thank you very much. Stephen, USA COVID prevalence infection rates began to drop before vaccination was widely administered. Was the vax a big factor in USA improvement? I think it was an important factor. Although it started dropping, but I think vaccination is a very important factor as well to add to the herd immunity. In the US, if you see, about 33 million people became infected. Now, the next part I'm going to say is, I don't know, right or wrong. Let's say another 50% of this number is asymptomatic, infected, and recovered. So that means 33 plus another 15 million. So that 33, 40, let's say 50 million people just became part of the herd immunity without any vaccination and just by exposure to the virus. Then take children. I think in US, Children under 19 are about 1/3. So if you take 100 million as children, add that to 50 million plus 100 million, we are already sort of half of the population, 50% of the herd immunity. Although children do not have the herd immunity, but still they are not as much at risk. They are spreaders, but not as much at risk. So then we are left with 150, which may be the reason that we started seeing a decline. Then on top of that, masks or social distancing or whichever way people protected themselves, was that ivermectin, was that vitamin D, was that some people who said, I deliberately exposed myself, I went into crowds and I wore no mask and I felt better. So I don't recommend that. But anyways, whatever were the people's ways, I think we were reaching a point where infection had to slow down. And then vaccines really helped as well. Look at India. Such a beautiful example of ivermectin's use. Imagine a few weeks ago, this was a disaster. What I would continue to think is, they are a 1.3 billion people's population. How would this stop? And they cannot just go vaccinating everyone right away. And here we are. It is declining. Robert, thank you very much for the super chat. Jawad Iftikhar, thank you for the super chat. Dr. Bean, I'm your new regular listener. Appreciate your sane and logical community service. You are very welcome, and thank you for joining the Cool Bean tribe. Cool Bean tribe is made up of folks who have very deep thinking and understanding of these systems. And we are here, almost all religions. We are here, pro-vaccines, anti-vaccines, something in between, and a lot more. Even today, I was actually feeling great. I was recalling Dr. Pierre Corey's talk here. I remember when he was doing a talk and he talked about ivermectin, and he was showing various studies. And one of the cool beans said to him that your study seems weak because p-value is not correct. And I felt so proud, not because somebody challenged him, but because it was not me, but it was cool beans who knew so much that they were able to think with him. That is the quality of this community, that we are diverse and we are more informed and educated, and we make our own decisions which we think are better for us. So I hope that suits you as well, and welcome. Nina Lord says, is it true that antibody test for virus exposure is different than the antibody test to see if vaccine has created a response? Some kits yes, and some kits no. Let me explain why. Good question. So let's say we have a kit that looks at the antibodies that are directed. So the kit has to be so specific that it can uniquely figure out. So let's say this is a spike protein, right? And let's say you and I are making a company and we are going to make a test kit, and that test kit is going to identify antibodies. Now for SARS-CoV-2, there could be thousands of antibodies against it. So we are going to decide that, hey, you know what? We should have those antibodies that have the most chance of being present, number one. And number two, maybe 2 or 3 of such antibody, if we detect uniquely, they are most chance of being present and least chance of being overlapping with other coronaviruses. So we don't start detecting human coronavirus and say you are SARS-CoV-2. So first we have to find unique antibodies, and secondly we have to find those that would occur in most cases. So we end up on spike protein because we figure out that, hey, almost everyone has spike protein antibodies. And that is maybe because we are making antibodies against spike protein to neutralize it. So now within the spike protein, we say, okay, how about this area, an antibody against this area, and an antibody against this area. These are the 3. Of course, the pattern there are different. So the antibody that would bind there, that binding site is going to be different, correct? Now, there could be more antibodies, in here, but we want to be efficient. We want to be cheap with our test kit that we are making. We don't want to make so many antibodies that it is expensive. So from FDA's point of view, 3 signals, these are called signals. 3 signals are sufficient. So now we have made a test kit that can look for these 3 antibodies. So their sequences are present here for the binding site. And then if you put patient's plasma here, which has patient's antibodies, then we can hope to identify these 3 and connect with them, and we can say, yeah, we found them. So good. This is how these test kits work. Now, believe me, if the coronavirus was, SARS-CoV-2 was just escaping all the time, like the person who was trying to debate with me yesterday, he was sending me things that, hey, there is no antibody idea against this spike protein and so on. Or anyways, so now let's say we give a vaccine, and vaccine also has the antibody, has the spike protein in it. So let's say this is vaccine generated spike protein. But let's say our body, that person who got the vaccine, his body decided to make antibody for this part, and maybe this part, and more. But their immune system decided that this pattern is not interesting. This pattern is not interesting. This is not interesting. If all 3 are missed, then if you take this vaccine, antibodies are there, but if you try this test kit on it, then the test kit is going to fail. Normally, the people who are doing the test, they know if their test kit can identify antibodies for the spike. And they would tell you that, hey, our test kit is not going to identify the vaccinated person. But majority of the people, vaccinated as well, are producing antibodies that are for those signals, and they can be detected. But this is the basic mechanism why some test kits can fail. This was an interesting outcome because in UK, when the variant arrived, the 117, the way that is so creative, the way they went after figuring out how prevalent is that one of the test kit, not all, one of the test kit was failing on one signal with that variant. So there was a mutation in that spike protein, which was not producing a pattern that was recognized by one of the antibodies in the test. So it was failing on one signal and 2 signal was going on. So they used this test kit to filter out those people who had the variant. That was creative. I kind of laughed when I saw what they did. So I hope that answers your question. A vaccine could actually produce antibodies, but it is possible some test kits would miss it. And I see some more super chats, so thank you very much. There is a super chat by Robert. Thank you and big greetings from Sweden. Thank you for your amazing video chat and more that you do. Thank you very much, Robert. And Sweden is my favorite country. My best friend Jan Rosen is from Sweden. Rubies are red. For your wonderful chats, incredible patience, and lovely disposition in dealing so respectfully with all of our different points of view. Bless you. Thank you. You're very welcome. And I'm proud of this. Mike says, question, please discuss shedding. Does ivermectin help prevent catching shedding? So, Mike, can you elaborate a little more? Are you talking about somebody who's taking ivermectin and will shed or not? Or somebody who's taking ivermectin and will they, if they receive the virus from somebody who's shedding, will they be protected or not? Can you please elaborate a little more? Aruj Som says, Arjun Som. Arjun, I saw you after a couple of days. Hi, doctor. If the COVID-induced antibodies are creating cytokines, COVID-induced antibodies that are causing the hyperinflammatory phase of the illness, how come the vaccine-induced antibodies don't cause a cytokine storm? So important, very, very good question. I'm going to restructure the question a little bit. It's not just the antibodies that produce the cytokines. What happens is when the virus arrives in our body, and so let's say this is our innate arm macrophage, and the virus arrives there. When the virus attaches to, let's say, some cell which has ACE2 receptors on it, and it enters there, and the cell presents it on MHC1, then cell throws out some of the debris, or the cell is killed by cytotoxic T cell, then macrophages become involved as well. These macrophages produce cytokines, not because of antibodies. They produce cytokines before antibodies are made by themselves. Innate arm can produce antibodies without cytokines without antibodies. Then the adaptive arm becomes active, which has the humoral part, which is antibodies, and cytotoxic part. And they both, when these are becoming active, there is helper cell, B cell, plasma cell, and cytotoxic T cell. They produce antibodies, cytokines as well. Then the cells, the tissue cells that are getting damaged, when they are damaged, this is their way of crying to release cytokines. Then the damaged cell, when they spill their guts, those guts can also act as a damage patterns. These are called damage associated molecular patterns, DAMPs. And those can also be looked up by the system to say, okay, there is something bad going on. I need to have cytokines and I need to have inflammation here. So it's not just antibodies. So how would I restructure your question? I would restructure it to say, if COVID or SARS-CoV-2 natural infection can cause cytokine storm, why are antibodies not causing, why are vaccines not causing cytokine storm? The reason is simple. In the case of COVID can go, in some people, it can go wild and just keep replicating, and the immune system can go wild trying to catch it and not become successful, or even after becoming successful, not calming down itself. How does the immune system calm down itself? There are regulatory cells. Imagine, the fights like MMA fights or wrestling fights, they all have time on them. They all have, let's say, 2 minutes round or 10 minutes total fight or whatever. And there are referees sitting in there to say, you are allowed 10 minutes and after that you stop. We don't care who wins, you stop. There are regulatory cells that are activated when the immune system activates. Their job is that within 2-3 days of the activation to stop the immune system or start reducing its activity. In some people, that regulatory system becomes nuts and it does not stop because of the virus just replicating and increasing. A vaccine does not do that. Vaccine does, it's 0.5 milliliter or 5 milliliter with a very tiny amount of vaccine in it. Vaccine does not replicate. So the vaccine will not continuously bother the immune system. That doesn't mean, for example, vaccine ends up producing a spike protein. What if the spike protein gets stuck in a cell? And now that cell keeps bothering the rest of the cells forever. And now we have a vaccine related, not a cytokine storm, but a side effect. So meaning vaccines can cause issues as well. Vaccines can cause allergies as well, where people can die with these allergies, but they don't cause cytokine storm specifically because they are not replicating like a virus does. So it's not about the antibodies. So Joel says, how much vitamin D per day is safe? Joel, what happens is the best way is to get your baseline. For example, I got my baseline and it was 19. And the credit goes to Avox, who's a cool bean on Twitter. I did not know what was my vitamin D level. And one day, and I kept saying that I should go check it. And one day Avox tweeted at me, his mocha bean, and said, do you want me to give you money to get your test done? He was a little more respectful than the way I said it. So I said, fine, I'll go get it done. So I got my test done and it was 19. Actually, slightly the other way around. Somebody sent me a test kit to do it at home and it was 19 at home. And then I kept saying I should get it from the professional lab. Meanwhile, I started taking 10 to 20,000 units per day, international units per day, with K2, with calcium, and separately with magnesium as well. And then I got my test again, and it was at, I think, 39 or something. So to answer your question, you can take, even there are preparations for vitamin D that are 200 or 250,000 international units that you can take in one day and just not take again and again. But 20, 30,000, some could be fine. But it really depends what is your baseline. If your baseline is already at 100 and you take more vitamin D, then I have seen there is a cool bean here in the comments who got some side effects with that. So it depends upon your baseline. And then 10, 20,000 is usually okay. That you can make with the sun as well. And knowing your level is important. Dr. Amir Hashmi says, sir, infection occurs within 3 months of the vaccine. Within 3 months of what? Gold Country says, Dr. Amir Hashmi, sir, I'm using ivermectin in my patients, doing great works. It's my honor learning from you. Love you always. Question. Thank you very much, Dr. Amir, and thank you for doing a good job. Please keep protecting. And Gold, thank you very much for relaying it. Jerry says, if vaccinated, key benefit of ivermectin is protection during first 24 to 48 hours, correct? So one day I had made this little chart that was this way. Let's say ivermectin has 70% efficacy, prophylaxis. Let's say vaccine has 95%, or in some people lesser than that, efficacy. Then let's say mask and social distance and other things have some efficacy. Let's say vitamin D has something as well. We can still end up in a place where they all have failed. Correct? And we can still end up in a place where any one of them has protected us, or they all combined have protected us. So to answer your question, that is ivermectin only for 24 to 48 hours when the vaccine related immune system is gearing up and getting ready to respond, who knows that vaccine system doesn't respond correctly? And I'm just making it up. Let's say 1 out of 2,500 people of Pfizer vaccine in their trial still got the infection. So what if I'm that one? So maybe ivermectin will protect me. What if vaccine failed and ivermectin failed, and maybe vitamin D level helped me? So this is why I think it's not just the 24, 48 hours. It is just a holistic, complete picture. But if we reconstructed your question to say within 24 to 48 hours, when the vaccine related immune cells wake up and they would do a good job, then yes, in the beginning, ivermectin would do the good job. Arjun says, thank you for the explanation, Dr. Bean. Sorry for being Mia, being busy with the baby. She keeps me up at night. Got it. But think about it. I have become, for example, Japan has not been here for some time. There are some more. So I remember the cool beans were not here. Rajesh says, why does Mrs. Bean have to suffer pain and take anti-inflammatory? Why not a short steroid course for long-lasting solution? So her doctor does not believe in that yet. Doctors here in the US, Europe, they're very hesitant with steroids. That is one. And secondly, I wanted to report on it. Do you know she feels so much better when she takes black seed oil? That is so interesting for me. She was taking anti-inflammatory, which was then giving her heartburn. Then she was talking with the doctor. He said, start taking omeprazole or Prilosec. And it was just the way the management was going was a mess. And then she started taking black seed oil again. And she has started feeling so much better. But with this, she still has a Johnson & Johnson, and somebody on our Discord server, I believe, somebody sent me a link to say that adenovirus-based vaccines can continue producing the issues for about a year or more because the virus stays in the cells for a longer period of time. I have to yet read that. So this is all that I gathered. I may be wrong, but I'll discuss it. So she's the one who is still suffering through that. But thank you very much, Rajesh, for your concern. JLB says, the problem is not to binding or non-binding antibodies, but if the macrophages, instead of phagocytosis, start to duplicate the virus, if it is possible. Very good. So that is the mechanism of the ADE that people say. So here is what they say. A normal behavior of a phagocytic cell is to use their FC2 receptors to bind with an antibody that has captured a pathogen or an antigen, and then eat this whole thing up, and then phagocytose it in a vacuole, then attach a lysosome with it, and then digest it. That is a normal behavior. And at the risk of getting a copyright strike here, I'm going to Google it for you, just so that you can see this. So phagocytosis. Go to the images. Here, this is a good diagram. Pathogen is outside, and then it is bound with the antibody to the macrophage. Then macrophage creates an invagination. It creates a pit. So imagine it opens up the mouth, and then it puts the food in it. So it opens up its mouth, it creates this invagination around the pathogen, and then engulfs it, and that becomes a purse-like thing, a closed bag that has captured the pathogen in it. And then it brings it in, and here if you see, this one is a lysosome. So do you see there are lysosomes here? So phagosome is the little prison that it has brought the pathogen in it. And then lysosome are digestive enzymes. So imagine the stomach of the cell. Then it combines them both, and that becomes a phagosome lysosome or phagolysosome. And that causes, see, this green thing was this thing, and that causes the destruction of the pathogen. This is a normal behavior. Our cells do it every day without any ADEs. But now if we go to this point, so your second question, instead of phagocytosis, start to duplicating the virus. The problem that ADE mechanism could be that when this antibody is connected here, as you are saying here too, when it is connected here, and when it is brought in, it could be brought in and it could cause 2 or 3 mechanisms here. One is the pathogen can escape from this phagolysosome or phagosome and just come out. And then it is going to start infecting the pathogen, macrophage, and then that infection is just like any other infection. The cell is infected and the pathogen is duplicating in it. Not a big deal. It happens. The cell is now infected. Meaning it happens not ADE, but cells get infected. And our body takes care of this. It's not a weird thing that some cell got infected. This is one mechanism. Another mechanism is that attachment of the antibody here can cause signaling within the cell to suppress not the attachment, bringing in of the virus in here can cause suppression of the interferon and other protective inflammatory cytokines to be reduced, which we know SARS-CoV-2 does. And somebody was saying this is a proof that vaccine will be bad. Well, normal SARS-CoV-2 does it too. This is not a proof that the SARS-CoV-2 can escape immunity. Our bodies, on daily basis, people are becoming sick and recovering. And SARS-CoV-2 is the same SARS-CoV-2. It does this in everyone. So if it was escaping, it would be escaping everywhere. But this is another possible mechanism. And then there are 3-4 more mechanisms. JLB, I have discussed them in the topic of ADE. I have done a video only on ADE and discussed how some dengue viruses we have seen it in, Zika viruses we have seen it in, HIV viruses we have seen it in. And then I also discussed if we saw them in vitro or in lower animals or in higher animals. And I also discussed coronaviruses in there. So Abdullah Musa says, you said the third vaccine my immune won't bother you. Said you can explain the mechanism. Could you please explain? And me having mixed dose, do you think it's safe? So I'll talk with data. A study I have, so the data I'm going to speak now, I have actually done talks about them, and those talks have the references to the studies as well. There is a study from UK about mixing and matching, and that study showed that people after a different vaccine, so let's say first dose is vaccine type A, and the second dose is B, and they had tried it with AstraZeneca and Pfizer. First AstraZeneca, then Pfizer, first Pfizer, then AstraZeneca, and Pfizer, and AstraZeneca. And they saw that second dose usually caused more intense side effects compared to a second dose of the same vaccine. So that was one of the studies. And I think you said that you took the second dose from another one and it didn't bother you too much. So you're clear of that. The second study was that they gave vaccine, they administered vaccine to those people who were already infected, and they gave them first and second dose. And they saw, so this is not a vaccine. This is infection, vaccine. So imagine the first infection was vaccine 1. Then the second dose, the first dose of the vaccine was the second dose, and then the second dose of the vaccine was the third dose. And I had done that study that what happened was, after the first dose of the vaccine, after the infection, antibody levels went up. But after the second dose, which was the third time body looking at the antigen, antibodies did not go further up. They were still at the level to kill that thing, but they didn't bother much to go further up and say, I'm going to go nuts now. That didn't happen. So when I say it is not bothered, that doesn't mean it would not care for the vaccine or the pathogen. It just is so now fluent in taking care of the pathogen that it didn't go further up. That is what I meant. And I have done that discussion as well. Okay, so I want to ask you a question, all of the cool beans here. Would it be, what day should we decide for our marathon with the questions? We'll start 9-10 in the morning and we'll continue. Would that be Monday, Tuesday, Wednesday? When would you like it? So that I can arrange food and things here for my family, so that when I'm sitting here, I just keep going. So please comment and tell me what day would you like. And this is also not necessary that cool beans are here all the time. You can come in, join, say hello, and then you can go back to your daily works and routines. So Dr. Amir Hashmi says, any role of steroid inhalers in COVID patients? Yes. So we have done this discussion in detail. Budesonide have been very, very helpful for patients of COVID. I use it after 2, 3, 4 days. I kind of separate it from the viral phase a little bit. There are doctors who have been using it on the first day with better results. I don't do it. There is a study from UK. They had great results with budesonide, 800 microgram per actuation, 2 actuations per day. But they started when the patient arrived at the clinic and they had symptoms. So that means patient already had symptoms at home. These symptoms became so much bad that patient eventually ended up in the clinic, and they started budesonide for them. So I would suspect that is 4 or 5 days after. So there is a very, very important role of inhaled steroids. And this study, I have also discussed it in a video. In that video, there is a link to the study as well.
I'm reminding you.
Alexa,
Feels like
stop. I do not know what Alexa was going to tell me. Please don't subject yourself to a marathon session. Steve says, don't subject yourself to a marathon session. Okay. I want to do it. So Rakshit says Sunday because that may be a off day. Sue says Monday or Tuesday. Jabra Bean says at your convenience. How about Zoom guests will answering? That's a very good question. So imagine we have Zoom guests as well who can have some discussion too, or who can come in and talk to. Kelly says Tuesday, day off. Some gold country says some of us work. That is why I said cool beans don't have to be here the whole time. Doug says weekend. Viji says Wednesday. Linda says any day works for me. Okay, so I think I'll have to then decide. Arjoon says doctors in India are now suspecting zinc supplements overuse to be a potential cause of mucormycosis because mucor apparently thrives in zinc-rich environment. Thoughts? So I had done that discussion as well. There is a suspicion that zinc and iron metals, and give me 1 second, Luffy needs the door opened. Actually, he opened it. Hey, Luffy. He had already opened the door. Okay. So there is a thought from the doctors from India that metals are interesting for fungi to grow fast. Metals can kill the fungi as well from outside, but when they are taken up inside the cell, it allows them to make more material quickly and grow faster. So because of that, it was thought that zinc dosage, that overuse that nowadays is causing this. I actually talked about that a few days ago. I looked at some studies as well that showed that zinc's increased amount or ferrous's increased amount did not have a significant change in the growth of the mucormycosis. So I would still stick to uncontrolled diabetes and steroids. And people were making fun of me that day when I was talking about this article. In that article, apparently they had written ivermectin as well. And I, instead of reading it, I said, and so on. So that was not my intentional thing. I just probably glazed over and closed it. So I do not think ivermectin would cause mucormycosis. Me, Shalini says, thank you, doctor. Very informative video. Silly question, but out of fear of mucormycosis, is it okay to go for a walk outside in the garden if a person had been COVID positive with mild infection? Yes. Mucormycosis would occur in those who are compromised, whose immune system is low. So that is the basic importance, basic requirement for mucormycosis. Immune system is suppressed or low, person is weak, sugar is more. So that means the person is probably still at home, bed bound, not very active, so they're not healthy yet, probably taking steroids, probably have nasal cannulas or other things that are still not very clean, plus may have uncontrolled diabetes. These are the usual structures that are necessary for mucormycosis to occur. So normal healthy person who's saying, hey, I'm going to go out and have a walk, I don't think you'll have a problem. Actually, it is a good thing. Even if somebody is on an oxygen tank, if they can have the oxygen tank and go out for a walk, that would help them become better faster. Kelly says, Luffy is learning from Dr. Bean. So if you look at that door, he has learned to kind of, use his paws or the talons, his nails to open it. But sometimes it is shut firmly, so he needs someone like us to open it. Otherwise, he can just pry at it and open it. That's what he did today. Arjun says, bows head to the kind doctor. You're very welcome. Abdullah Musa says, I just had the mixed second dose today. It's been 14 hours, so let's wait and see if so about 24 hours. But if you are good at 14 hours that you're sitting here talking, then I would feel that you would be okay. I just feel pain on the side of the injection, nothing else. So when does symptom? Normally symptoms start within 24 hours. So everybody's body is going to respond differently, but within 24 hours, the memory cells are going to wake up, look at the spike proteins or look at the vaccine and start reacting to it. So 24 hours. I think you'll be okay. or I pray that you'll be okay. William is here. William, how are you? You spent so much effort helping us out with the information to keep us and our families healthy and mentally give us hope. What can we do to help you as you give us so much? And so this is the most important thing, is for us to get together. That is actually useful for me as well. After this, if you can help, then that is to like, subscribe, share. That allows me to earn some revenue from YouTube. If you can further help, then of course you can support me with those links, and you can buy me a coffee, or you can support through PayPal, or be a Patreon. If you're a Patreon, I feel that you can continue to pitch in for, even after the pandemic, for me to continue to teach medical students and nursing students. I think these kind of teachings are less available, and it is useful for upcoming generation, and that can help them do better, have better patient outcomes. So I think that is how you can help. But I have always said it, and I would say it again. It's not about the money. I didn't start it with the idea of the money. And I have had lots of losses during this time because of my attention to the teaching here, possibly in millions. But I have never talked about that. So if you feel, sometimes people send me a comment that, hey, I'm not in a position to support you. And I feel bad that they feel that they have to support me. So you don't have to support me. Please realize this. This talks, they do not have a precondition of any support. So William, thank you very much. So William says, I will always do my CEUs through you for my nursing CEUs. Thank you very much. That will be awesome. Shujat Heather says, I need your words on Pfizer vaccine and rare cases of myocarditis reported. So I'm going to talk about myocarditis in another day as well, because I think there are some reports with Moderna too. So I'm collecting that data and I'm going to read it. I'm Dr. Jeffrey, practicing in UAE. Really appreciate your work. You're very, very welcome. Give me a couple of days and I would talk about this as well. Thank you so much for the super chats. Kathy says, yes, Dr. Bean, can you comment on the reports? Yes, I would do that. I actually collected some data and links. I just didn't have time to go over them. But that is my top priority to discuss. The long haul protocol is still behind, although I have sent them the draft. So I saw Dr. Paul Marek had actually created a long haul protocol from that draft, but they still wanted me to kind of finalize it, and I have not done it. I will work on that too. Lots of things to work on. Dr. Amir Hashmi says, sir, why reinfection occurs previous COVID patients while antibody is present? Couple of things. So if I look at your question, just looking at the question, I would answer it that means the new COVID, new infection has escaped previous antibodies. This is looking at your question. Generally, reinfection is occurring in those folks who have some immune system change, or who did not develop a good response in the early time. So that is how the reinfection is occurring. And reinfection, simply meaning getting the infection again, can happen in vaccinated or infected. Our immune system can take 24 hours to wake up and remember from memory and take care of the infection. So that means a person can get the infection and become sick for 24 hours, but then recover fast. If I'm getting infected for the first time, it would take me 5 days, 10 days, 15 days to mount a response and get out of it. But reinfection would mean majority of the cases I would not even know that I was reinfected. My immune system would take care of it. In some cases, for 24 hours, I'll be sick, and then my immune system would take care of it. And in some cases, it just continues, and there is either the variant is so different that our immune system cannot work with it, or our immune system is not robust enough. Could be vitamin D issue, could be comorbidities, could be diabetes, uncontrolled diabetes, could be immunosuppressants with steroids. There are many, many reasons for us not to mount a good response. Hammy QBean says, both my parents' doctor told them their antibodies are good for 10 years. How does their doctor know that? They don't know it. The only way to extrapolate is from SARS-CoV-1 or MERS-CoV or other coronaviruses. SARS-CoV-1 antibodies have been seen to be there for 2 to 3 years, but not 10 years. MERS-CoV's T cell, cytotoxic T cell, have been seen to be there for 10 years. So this 10-year tells me that this may be a T cell behavior, but not antibody behavior. This is from the other cousins viruses, not this virus. Of course, this virus has not been around for 10 years. Gold Country says, so we cool beans are slowing down the FLCCC work. That sucks. They are actually quite independent. So I have given them the thing, and Dr. Paul Marek has been working on it. He actually sent me that here is what I wrote. I had to just do some final cross the T's and dot the I's, which I didn't do. So so I'm feeling embarrassed now. I'll do it tomorrow. Rakshit Rao says, treatment for post-COVID chest pain and tightness. Start with so as long as the chest X-ray and HRCT shows correct state of the tissue, then the inflammatory state can be managed with ivermectin and steroids. So first, chest X-ray or HRCT to see what is the state of the lungs, and then the next. Arjoon says, Doctor, have you seen the latest data from Public Health England that says that only one dose of Pfizer gives only 33% protection from 1172 variant? Yes. So I saw that and I discussed it as well. We'll do some more discussion too. Isn't that instead of 117, are you talking about 617.2, India's originated variant too? Yes. Tammy says, that's why my mom called the antibodies could be 10 years. Yeah, no, antibodies are not known for the cousin. Maybe this virus has antibodies that goes for 10 years. We haven't spent that time. The cousin virus is 2 to 3 years. So William says, I've had many people report chest pain reduced by simply using aspirin prostaglandins. Very good. Thank you, William. Doug says, I've seen Dr. Corey talk about releasing long haul protocol in about a week in a few interviews. Is he helping you all? So Dr. Corey actually is helping shepherd us and saying, hey, you got to write it. And he said to me, last email was that, hey, hurry up, because we have to then send it to the designer who has to put it in a design, and then we have to publish it as well. Good news is that Dr. Marek has, he's very hardworking, Dr. Marek. He has actually put it together. So stop embarrassing me. I'll do it tomorrow. So I'm going to start blushing now. Okay, so Thrill says Moderna 2.5 months after dose 1. Would dose 2 be less intense? We do not know about that from a data point of view. I would think that it would be less intense from the UK's discussions, but Moderna's data is not released. So I would think it would be less intense, but I cannot guarantee it. Bambi Secret says, please, can you look at the question on my super chat, please? I asked if second Pfizer could elevate the protein C function estimate on blood test. Let's see. Arjun. Okay, so Bambi, the super chat has scrolled up. Tell me, so I'm seeing your question and I'm going to continue to see for your question. Please, if you can elaborate further. Please, can you look at the question on my super chat, please? I asked if second dose of Pfizer, could elevate the protein C function estimate in a blood test. So yes, here is why. Protein C is nothing but an acute phase protein released by the liver when there is a need for innate arm to work more. So any inflammation, vaccine caused or infection caused or autoimmune, any such inflammation would cause cytokines to be produced, which will go to liver and say, please release acute phase reacting proteins, in which protein C is also released. So it can actually go up. So Ms. Shalini says, Doctor, one more question. They're talking about some white fungus and yellow fungus now, out of which yellow fungus is more deadly. It starts internally. What does that mean? So I'll have to read it as well. Black fungus is called black fungus because it causes necrosis and blackness of the tissue which it infects: skin, eyes, nose, ala of the nose, jaw, teeth, respiratory system. And the white fungus simply means a fungus that is not causing blackness in the tissue. I still have to read what fungus are they talking about, Candida or some other, and then answer that question. You'll have to send me this question either on Discord or on Twitter so I can work on it. VG says, Dr. Bean, please acknowledge my comments. So is there a comment here, VG, or this is the one? Morifat. So Morifat, for you, I did the previous discussion about the neutralizing antibodies. Your question was excellent yesterday. Thank you so much for continuing last session and clearing my doubts. I have one question. Here in India, the gap between the two doses have been increased from 4 weeks to 12 weeks. What is your take on it? So if we go to the way UK did, UK went from 2 or 3 weeks to 84 days. And they actually showed good efficacy, number one. Number two, they were able to spread the vaccine to a wider population faster with one dose. So I think if we follow UK's trend, it is a good idea. I was critical of UK with that. I still feel that from a data point of view, that was not correct. But they took a brave decision, and that was a correct decision. Or the outcome was correct. So Mankinata Sivapala says, what's your opinion on enhancing in boosting of the NK cell? Enchinacea in boosting of echinacea. I have no idea. So NK cells, we have done a discussion for how to boost them. This may be a good booster as well. I do not know. The boosters for NK cell are less stress because the stress hormones reduce the activity and production of new natural killer cells. Then phytonocyte or phytoncites, that are the oils produced by plants. So if you stay near the plants or go in the area where plants are, forest or jungle or something, then light yoga, light exercises, not stressful exercises, because stressful exercises is Luffy, he's come back. Stressful exercises cause stress, which would then suppress NK cell. Light exercises, for example, yoga or something else, would actually enhance the NK cells as well. And finally, anything that would keep you stress-free, whatever that is, it music, is it dancing, is it just relaxing, is it meditating, is it whatever. Everyone has something else, something different that makes them happy. Whatever makes you happy will make your NK cells more and better functioning. But I do not know about this one. So guess what? Luffy went and Kyrie arrived. So they have something going on in that room. Rakshit Raj says, does zinc boost NK cells? I'm not sure. I have not heard of zinc doing it. Okay, so Mike says, will ivermectin pretend catching the results of shedding due to the vaccine? So first of all, Mike, this is actually an incorrect theory. This is promoted by folks who don't like vaccines, and this is totally unscientific. and that is that being near somebody who's vaccinated will cause people to miscarriage and have irregular periods, or vaccinated people would shed, causing unvaccinated to be to receive the vaccine. So number one, to receive the infection. Number one, infection can come from anywhere. So generally, ivermectin is supposed to help. Vaccine is supposed to help. Better vitamin D levels are supposed to. We cannot stop a virus from entering us. We can just hope and prepare our immune system to be able to defend better. Vaccinated people, the study that I discussed, I had done that discussion of the vaccinated people. It's a Pfizer study. They said that shedding in vaccinated people reduces down to 74%. So that means by 26%. How accurate is that? We don't know. It is difficult to measure. For example, I'm vaccinated. How can you tell I'm shedding or not shedding? Or if I'll shed less or shed more? Shedding simply means you got the infection, the virus replicated, and now you have it back in your breath, or you're in the droplets. That would happen. The shedding would happen with the unvaccinated as well. If you're going to be careful, those who are not vaccinated and are infected, they would shed more. So shedding can happen with everyone. Now, if I say, is ivermectin useful? Yes, it is useful. Vitamin D is useful. Staying healthy is useful. Staying happy and relaxed is useful for NK cells and so on. Of course, vaccine itself is useful. C. Patty says, when with Novavax being made differently from the mRNA and adenovirus, could the Novavax have the same blood clotting issue seen now? Somebody had sent me the mechanism for why blood clotting is occurring. I read a little bit of it. It seemed incorrect to me. So far, we do not actually know what is causing that. We know that antibodies produced against adenoviruses may be causing it. If that is the case, if I am correct, which I do not know, then Novavax will not do it, because Novavax does not have adenovirus in it. But I do not know if I'm correct. I think it is adenovirus that causes it, but I'm not sure. So Jennifer Boyer says, any way for unvaccinated to protect themselves from shedding from vaccinated? We are nearby. So I just answered this question. Your question should not be protect from vaccinated. Your question should be, how do we protect ourselves from getting the virus? And that is a standard answer. You wear your mask, have a social distance, wash your hands a lot, and then take vitamin Ds, take ivermectin. There is no guarantee with all of those, but these are the ones that reduce the chances, and get vaccinated. Doug says, okay, so this is some discussion that is going on. Sorry, I thought this was a question. So how about we stop here for today, and we will continue our discussion tomorrow. Thank you very much. Please don't miss tomorrow. We will have Dr. Hector Carvalho. That is the best thing that would happen. So I'll see you tomorrow. Please, in the meantime, like, subscribe, and share. And secondly, if you would like to support this work, if you like this work, want to support it, want to have this work for others as well, nursing students, medical students, then you can support it through Patreon. The link is in the description, or PayPal, link is in the description, or buy me coffees, whichever way you like. And if you didn't want to support, that is fine as well. Or if you can't support, that is fine as well. Thank you very much, and bye-bye.